Painless Normal Delivery, others who are watching this app. Actually, before starting up the session on the topic Painless Normal Delivery, let me give an introduction about myself. My name is Sowbarnika. I'm an internationally certified birth educator, and I'm an author of the book Fetal Education. This is my book. It's all about how you want to take care of yourself during your pregnancy. Okay, let me start delivery. It's painful like that, but it is not like that. Okay, you before that you want to know what is pain. What is you are experiencing some emotional feel that is called as pain. The transfer from your uterus to the brain. When the pain signals transfer from your uterus to the brain, then you will feel that emotional experience. Then you may feel that experience. So this is the pain. Before knowing about painless normal delivery, you want to know what is pain. Now you know what is pain. It is simple. It's an emotional experience. And what is the labor pain? It is that pain signals are transferred from your uterus to the brain. This is pain. So what it is? Painless normal delivery in the sense, first painless actually the delivery of a person is explained. One is normal birth. Okay, that is normal delivery is different. C-section is different. Third one is natural birth. C-section, we all aware of it. C-section. So what is that normal delivery and natural birth? What is the difference between normal delivery and natural birth? Normal delivery is that delivering through the vagina with medication, vaginal birth with some medications. Okay, that is normal delivery. What is natural birth? Yes, this is what our women or our elders or our grandmothers had did in earlier days. That is natural birth. Vaginal birth without any medication is called as natural birth. This is the difference between normal delivery and natural delivery. Normal delivery is that vaginal birth with some medication, whereas the natural birth is without any medication. When women is capable of delivering the baby through the vagina, then it is of course natural birth. So which is going to be painless one? Anyone. If you are a pregnant mother, mainly pregnant women may be having only 3 points in their mind during their pregnancy. What are those 3 points? One is health concern. Very first thing, health concern. Second thing, how I'm going to face my labor. This is the second thing. Third thing, how I'm going to deliver my baby with a good weight gain of the baby. This is the only three things. Every pregnant woman will be always thinking about only these 3 points in their mind. First one is, as I said, first one about the diet, health conscious. When you have a good diet, eating good things, fruits, veggies, you are having a handful of nuts, you may know about it. Having that means your health wise everything is okay. That is the concern. Second thing, about labor, how the labor will be, how the pain will be, how I'm going to manage it, all those things. And the third thing is weight gain of the baby. Weight gain is 100%. It depends on the diet what you are eating. Okay, this is the thing. So we'll focus on the second one, how the labor will be, how the pain will be, what the and what stage the woman's mindset will be. Let's see all those things. So before starting it, the second point, now we know what is pain, what is labor pain, we know those things. So how to make our labor pain painless one? It's a very simple thing. Many hospitals or birth centers are focusing on these things. What it is, very first thing, epidural. The injection called as epidural is available in all the hospitals. You can ask your gynecologist or obstetricians to have it. And when you focus on the epidural, when you have the epidural injection, while having it, you may feel your labor as the painless one. So how it will be, how that epidural injection will be injected, we'll see this. How it will be, in the sense they'll be injecting this epidural injection in the backbone. It will be injected, it will block the pain signals. As I said already, the pain signals will be transferred to your brain from the uterus. Once the pain signal is transferred from your uterus to the brain, then you will feel the pain. So this epidural injection will block those pain signals for a certain period of time from traveling from your uterus to the brain. It will just block the signals for a certain period of the time. This is what the purpose of that epidural injection. And the second concern is that only once you can have this epidural injection. You can't have this for doctors will not inject this for long time. Okay, by having this you can make your labor pain as a painless one. It is not that you cannot experience the pain at all. You may experience your pain, you will feel your pain, but for 90 percentage of your pain you may feel relaxed. Okay, other than this, is there any procedures available to make my labor pain as the painless one? You may ask like this. Yes, it is available. What is the thing is, three things. Okay, three pillars for the every pregnant woman have considered this in their mind. The very first thing is confidence. Your body should know about what it is doing, how it is focusing. See, baby knows everything inside the womb. Baby is aware of everything. Grown, everything baby knows. Just one thing, you want to cope up your baby. See, I'm saying one example for this. You think there is a barrel. This is a barrel. One rat has locked inside this barrel. Just think it, which is very difficult. For the barrel it is difficult, or for the rat it is difficult to come out. Just think, this is barrel, this is rat, this is locked up inside this, and you please think for whom it is difficult. For the barrel it is difficult, or for the rat it is difficult to come out? Obviously it is difficult for the rat to come out, right? Nothing work the barrel is going to do with it. Just one thing, the barrel want to support the rat. See, the barrel is stable for 9 months, and immediately once the barrel feels the pain, it is dancing and shouting and screaming. What happens to the rat which is present inside? The rat will get scared, right? Obviously, and rat will get scared, and rat's heartbeat will get increased. Rat will feel the more pressure. All these things will happen. Same as like that barrel, you are going to be in one condition, one stable position. Your mindset will be stable for 9 months of pregnancy. Then immediately once you feel the contraction, if you feel the contraction, what you will start screaming, you start feeling very nervous, your blood pressure increases. If all these things happens, what happens? The baby will feel some physically or emotionally, the baby will feel the pain. So the baby will not support to come out. The baby wants to, while you're pushing, during contraction, the mothers may feel like pushing. It is an urge feel. Okay, it is a nature. When you're pushing, your baby wants to cooperate with you. Your baby wants to support you. Baby wants to come out. All these things should happen. So once you shouting, you feel like shouting, screaming, you feel unstable, all these things happens means the baby won't come out easily. Then obviously you may feel the pain. Actually, it is a beautiful experience, when you did not shout, when you feel calm, when you are patient. And during your 9 months of pregnancy, you had followed some meditation, regular meditation, or you had followed breathing techniques from the birth educator, followed in your prenatal classes, or from the YouTube. Many resources are available to follow breathing techniques, but one you have always referred with your gynecologist before following up. So once in the entire 9 months of pregnancy, if you're following a regular pattern for preparing yourself for labor or delivery, means then you can cope up the labor. You know what will be happening in the labor, how the pain will be. See, very simple. No need to urge yourself how the pain will be like. It will be like cramps, menstrual cramps. You will be feeling back pain since you are having an epidural injection in your time. You're having epidural, right? So that or most of your pain body will get relaxed. Only thing, your mind want to be relaxed. For the relaxation of your body, you're going to have an epidural injection that will helps you and your baby to support very well during the labor process. So what happens to the mind? Only when you followed a particular set of meditation or a particular set of breathing techniques which is guided for you by your practitioner during your pregnancy time will help you to cope up the labor. See, I got a few questions from the Mylo app viewers. To answer those, we got a set of questions. The first question what I got is, does epidural affects my breastfeeding? No, definitely having epidural injection during your labor time will not affect your breastfeeding. It is completely a different portion. It will just relax your body. It will not block or interrupt your feeding hormones, breastfeeding hormones. It will never interrupt like that. And the question we got is, does epidural causes back pain? No, epidural will not cause back pain for you. It is completely safe. You can go with any second thought. No need for any second opinion. You can go for the epidural injection. It will not cause any back pain. Will I able to push if I use epidural? Yes, of course. You are completely able to push. It is an see. Pushing is different from having an epidural injection. Pushing is that it is an see. It is all the nerves are connected to your brain. Once your baby is urging to come out, your brain impulses will make your nerves to push. It will be a nature. Only thing you want is energy and stamina. Okay, when you have a good level of energy and good level of stamina, definitely you can push your baby, and there is no any interruption between this epidural injection and pushing. And other thing, one of the mother in my class had me ask that what is the difference between contractions, I mean true contraction and labor contraction, and how do I come know about that I am in labor? How can I find that I am in labor? See, very simple. As a pregnant mommy, you want to know the difference between true contraction and false contraction. What is the true contraction and what is the false contraction? Every mother would experience this false contraction. Okay, it will be like you'll be gaining the cramps, like menstrual cramps, menstrual pain, minimum amount of back pain every 1 hour once. See, if you are getting the pain at morning 10 o'clock, then the next pain you'll be experiencing at evening 4 o'clock. This is the long gap, right? There is no regular pattern, there is no regular rhythm, there is no frequency in between the pains. See, if you are getting the pain at morning 10 o'clock and you're getting the next pain at 11 o'clock, and next you'll be getting your pain at 12 o'clock. Okay, there is some period, there is some regular rhythm. Okay, and the pain will be getting more and more closer together. Okay, if you are getting the pain at 10 o'clock, then next pain at 10:45. The time period is getting closer together, and the next pain you will be experiencing at 10 o'clock and 10:30. Like that, once you are getting your pain every 10 minutes once for 3 contraction in the sense pain, we'll be calling that pain medically in as contractions. Okay, 10 minutes once you will face 3 contractions. Every 10 minutes once you will get 3 contractions. That 3 contractions will not be continuous, as like you are seeing in film or in drama. A pregnant woman will be screaming and shouting for long time. No, definitely that won't happen. Do you know how it will be like? You will be feeling the pain for just 60 seconds. Okay, that too initially you will feel the pain for 30 seconds, then 3 or 4 minutes gap, then again 30 seconds, then again 3 or 4 minutes gap, you will not feel any pain, and again for 30 seconds. This will be at the first stage of your pregnancy. Okay, now I'm explaining the difference between true and false contractions. Every mother should be definitely aware of this contraction before facing their labor. Okay, so please listen this point carefully. The next thing is that, see, you're getting a contraction for 60 seconds, means next you'll be having the gap for 1 minute. Within 1 minute gap you won't feel any pain. Next for 60 seconds, next for 1 minute you will feel the contraction, next for 1 minute gap. See, if you are wasting your energy, your body is draining the energy every time, means you can't cope up the labor. So how to cope up the labor, how you can face? So if you are facing the pain for 1 minute, means next you'll be having your body will give 1 minute gap. So you can follow the breathing exercise. You can see the clock, or 60 seconds, you can follow the breathing techniques. Next for again 1 minute. Again 1 minute, you will feel the pain. You should not tight your body, or you should feel very relaxed. In that 1 minute also, see, it is a beautiful experience, you know. You can feel the pain. You can feel the baby is turning in your womb to come out. Once you are pushing, means your baby will come out, and you stop pushing, means your baby will go back. See, you can feel it in the normal delivery process. So when you get regular contractions in a regular time period, when the contractions are more and more closer together, means then it is a true contraction. This is the difference between true contraction and false contraction. Okay, you want to know this difference. So once you get the true contraction, means you can go to the hospitals, and the doctors will be, if you are supposed to have an epidural injection, means your doctor will be suggesting you an epidural injection in this phase only. You want to get 3 contraction within 10 minutes of gap. So 60 seconds you'll be facing the pain, and 3 minutes you can relax. What you can do, you can think about something, or if doctor allows your partner, means your partners can massage you, they can hold your hands, or you can follow the breathing techniques. You can follow something like this. Now you know the difference between the true and false contraction. This is the thing. And other question we got from our Mylo subscriber: how I will feel when I use epidural? See, it is a simple like an injection. You won't feel anything. A simple needle in your backbone, in your spinal cord, it will be, they will be poking needle. Little pain you will feel, nothing more than that. But your body will feel many things. Many hormones will generate at that time, and your body will feel more relaxed. Okay, this is the next question we got from our Mylo app is this. Since you are saying that we won't get back pain because of using epidural injection, then what is the reason for back pain after delivery? Why I'm getting back pain after delivery? It is completely because of calcium deficiency in your body. It is not nerves and bones are stressing. Because of this, do I'm getting because of this, do I'm getting back pain? No, definitely less. Yes, of course. It's a very good and welcoming question. I appreciate this question as well. Definitely following the exercise in regular, giving a regular exercise will definitely reduce your labor pain. You may feel painless. And one thing, before following up the exercise, one main thing you want to focus is, you don't have to stretch your body. You just follow king of exercise. You know, walking is called as king of all the exercises. So you initiate walking in your daily life. Once you initiate walking, all the ligaments and the muscles, pelvic floor muscles, all these things will get loosened, and you will feel like having you won't feel much pain. You may feel painless. And at 37th week of my pregnancy, yes, it is safe once if your doctor is supposed to do because of some problem, some women with diabetics, gestational diabetics, or some other problems you may have. If it is like that, yes, definitely it is good. But if you are opting for C-section at 37 weeks of pregnancy, means you should focus on that. It is not advisable, because nothing problem in that. One major thing is that lungs, heart, kidneys, of all these inner organs of your babies are maturing only at the last trimester of your pregnancy. All these parts of your baby will be developing, it will be maturing until the 6 months of your pregnancy. They're just forming, they will take time. Once you are entering the 6 months of your pregnancy, you will get time to the baby will get time to develop. It won't time. So at 37 weeks of your pregnancy, all these organs will be immature, they won't get mature. It will take, once you enter at least the 38 or 39 week of pregnancy, means your body will also get good stamina to deliver the baby. Once your body gets good stamina, you will feel painless. Very simple. Okay, and another thing, see, as a pregnant mom, you want to focus one important thing. You first understand one, I'm saying one example, you please understand this. Two women is there. One woman is lifting 10 kg of weight and other woman is lifting 20 kg of weight. Okay. Both are women, same category. This woman is lifting, A woman is lifting 10 kg and B woman is lifting 20 kg. What is the difference? Why she can lift only 10 and she can lift 20? What the reason might be? What you are thinking? Definitely it speaks about their stamina, right? So here the feedback that I'm feeling very painful, I can't, my legs are paining, my backbone is paining. She's registering a feedback like this, but she had lifted only 10 kgs. And this woman, B woman, who lifted 20 kgs, registered a feedback that, no, I don't feel any pain. I can feel that object which I'm lifting, and no pain for me. Actually, I enjoyed lifting this. This woman is saying like that, but she lifted only 10 kgs. She can't bear the pain. It's painful for her. But the woman, B woman, said that I can lift. It is very easy for me. What is the reason? What the reason you might think for this question? Obviously the stamina and capability, the word capability. So capability of each and every woman is different. Okay, so while delivering the babies, most of the women are thinking that it is a painful one, I can't bear the pain, it is very painful, like that. It is a worldwide understandable concept, but it is not like that. It's, see, every human being is having a reproductive system and they are delivering the babies. So it is a natural process. It won't be painful as like you're seeing in dramas and cinemas. Okay, it completely depends on capability and ability of a person who are delivering. Okay, the ability and capability of a person varies from one to one. Same as like that, labor and birthing process of each and every woman is different, is unique. Two women will not have a same birthing process, same deliver process. They will not experience the same pain. One woman may say that after delivering a baby, see, I had collected data from which the pregnant mothers delivered the baby from my pregnancy and parenting care classes. In that, 60% of the women had undergone the vaginal birth with medication. They had a vaginal birth, that's normal delivery with epidural injection, and 30% of the mother had gone normal natural birth, that is called as without medication. And the women, 60% who had their labor with medication through the vaginal birth, they had registered a comment that few comments they had registered. I got a feedback from them. They said, my labor is painful, but I can bear the pain since I had followed the techniques, breathing techniques, which I followed from your class. This was the thing they had said. And few women had registered a comment that, yeah, it is completely painless, and I enjoyed the my labor with the help of the partner and with the help of my gynecologist who supported me very well. And other women had registered that i I don't know what happened. It was like a miracle. I don't know what happened. I delivered my baby naturally. I'm happy. That's it. I don't know. But it was like a different world, different experience. Now I don't know what happened. This is what the comment. And other women had that, yeah, I did walking. I had a good diet, and I had followed everything, and I had a minimum of pain. As you said, I followed. I had a minimum of pain, but it is bearable because I increased my capability of bearing the pain. This was the comments registered from the women. And actually, to end, shall we end up the topic? Let's end up the topic. Okay, having the painless normal delivery is possible or not? This is simple of whole this content. Yes, is absolutely. Having the painless normal delivery is completely possible. Very simple. How to follow, how it is possible? You should have capability. I said two examples, right? Capability of the women, 10 kg and 20 kg lifting, that plays a role here. You should increase your capability, you should increase your stamina. Other than that, you should prepare yourself for the facing the labor, how it will be, how to prepare yourself. You can attend the online classes. Many resources are available in this technological world now, so you can get educate yourself better. You can meet up a birth educator or some pregnancy care counselor who suits your needs, who can satisfy all your needs, and who can understand you personally, and like that you can follow up with them. Definitely it is possible. You can crack the journey of a labor journey, and you can become a beautiful hero, beautiful, not a simple hero, beautiful hero of this labor birth story. Okay, let's have a beautiful journey. Okay, let's end up the session. Thank you.